Welcome to the Core Women Podcast, the place for women entrepreneurs, authors, and self-starters looking to build community and gain valuable insights through expert interviews with women at the top of their game. Join your host, podcaster, producer, expert coach, entrepreneur, and author, Dr. Summer Watson, as she aims to inspire and empower you through these candid conversations. Lean in and embrace the journey. It's time to start the show. Here's your host, Dr. Summer Watson.
On this episode of the Core Women Podcast, I would like to welcome Chenai Kadungure, a Pan-Africanist, equity champion, and dynamic leader whose impact spans Africa, the Caribbean, and North America. As the executive director of the Black Physicians Association of Ontario, Chenai is dedicated to driving meaningful change in healthcare and equity. Her career includes leadership roles with Black Youth Success, Skills for Change, and Care Canada, along with board positions at organizations like Born Ontario and the United Nations. Recognized as one of Canada's top 100 Black women to watch, a Gold Women Changing the World Leadership Award recipient, and an RBC and Global News hometown hero. Chenai's influence is undeniable. In this conversation, we will dive into her journey, the power of global thinking with local action, and her unwavering commitment to equity and leadership. Welcome, Chenai.
You.
Yeah, I'm so excited for you to be here with me.
Me too.
Awesome. Well, let's get started. Let's jump right into this. But before we dive right into your professional background, your evolution of how you started all this incredible stuff in your life, if you could describe your journey in one word to this point, what would that word be and why?
I think it would be actualization.
Okay, tell me more. Tell us more.
Well, I've always been passionate about the concept of, what is my highest self? What does a person look like when they have the best resources available to them to make the best choices so that they can have the best possible life? And so the decisions I've made in my life have always related back to that hope of getting to my highest self.
Let me ask you a question based on your answer. Where did you find that drive, that mission, that passion? Was that innate? Was that something modeled for you? Was that something learned? Tell us more.
I believe it's nature and nurture. I believe it's both. It was both as far as my father. My father was a very large motivating force in my life, and he was an affirming source in my life. And without that sort of foundational affirmation and support, I don't think I could be doing half of what I'm doing now. And so when we think of, love and belonging creates esteem, which then leads to actualization, for me, it's that. Like my dad was that love portion that helped the esteem to do everything else that I do now.
Isn't that incredible? I feel the same way about my mom.
Mhm.
It's not that she didn't come and we didn't come with issues ourselves and all that stuff that is integrated into a relationship. And especially as we're growing and trying to individuate that kind of, where we would rub against each other in a way that it's like, okay, I get you, but I still don't necessarily wholly believe in all that condition. But that foundation that they laid for believing in ourselves, that faith and hope that we could achieve anything we put our minds to was so valuable, so important. And I find that based on your bio, you're giving so much back in that same way. You're modeling that same behavior in community, which is something we're going to get to. Your leadership work spans multiple continents. You have such global experience. It shaped your approach to equity and advocacy. Talk to us more about that.
For me, I also say for people who do not travel, they are missing out, not just on finding themselves, but on also better helping people around them. For me, I come from Zimbabwe. We're a tiny country, and most people don't even know we exist and where we are, right? We're just right above South Africa. And leaving the continent and then sort of like coming to the US and just being so exposed really helped me to understand not just the importance of like how we are developing people, but again, like I say, like a better understanding of self to say, oh, my frame of reference was missing 1, 2, 3, 4 things. And that added to barriers in my life. How do I remove these barriers for other people?
Yeah, and that is so critical. I was talking to someone earlier today, And it was incredible some of the things that she was doing in the tech and med space. What she was doing was educating people and also providing training for people who didn't even know that they could be in that space. So it was educating people about what they didn't know. There could be an advertisement for a tech or medical position where you just pass it by and go, oh, I don't qualify. But in actuality, the way that they've described it, maybe you don't understand that you actually do qualify, but it's the way that they described it, which kind of you counted yourself out.
Yep.
So it's interesting knowing what we don't know. And when people bring that awareness to us, we're like, really? Oh, wow. And when she was talking to me, I was like, I wouldn't have even known A, B, or C that she was describing. So to bring that awareness, to do what you're doing, again, to have traveled around the world for that exposure, to have that awareness, to learn certain things, you're bringing that to people in a different way, which is so exciting. You also touched on actualization. And a lot of times when I was going through my career path, especially my master's degree as I was going through counseling, some of the other students would be like, well, why do I need counseling? Why do I need to continue to do A, B, and C? Because it's about self actualization. We don't stop self actualizing until we're gone. And we have that opportunity. And I love that this is your word because it does speak to who you are, it does speak to what you're doing in community. You are continuing to grow, embrace, learn, and be passionate about other things that maybe you knew or didn't have an awareness of, or you're continuing to learn and embrace other things that people are teaching you as well, which is really exciting. You have done so much in regards to being the executive director of the Black Physicians Association of Ontario, Canada's top 100 Black women to watch, a Gold Women Changing the World Leadership Award. Tell us more about being the executive director of the Black Physicians Association of Ontario, and what are the biggest challenges and opportunities in creating a more equitable healthcare system?
Wow. So I will say that health equity is still a unicorn. I don't even know that there's a place that is necessarily doing it very well. And part of it is because so much of what you're taught in medical school does cause harm. There's the irony of do no harm, but you're taught to cause harm because, as an example, in a system like we have, your average time with the doctor is about 15 minutes.
Mm-hmm.
The doctor is not going to know anything about asking you deeper questions or technically even being able to make a diagnosis in that amount of time. So it's designed to be impersonal, designed to be just kind of, let me get you out of the room. And it's not their intention. It's just the way the system is sort of like burdening them right now. So we do a lot of work with community health centers where the average time is actually 30 minutes. The doctor has better bedside manner with patients. And because you have that relationship, you're actually almost having like a proactive preventative health model with the patient, as opposed to just, I'm going to sort of just give you random antibiotics and painkillers and hope for the best. So I think there are a lot of negative health outcomes for racialized communities, particularly because there isn't that deeper work happening. And so we try to push for that as much as possible. But some of our work is also around advocacy. So the breast cancer screening age in Canada was decreased to 40. The guidelines used to be 50 because organizations like ours were advocating and seeing that, look, so many of our community are getting breast cancer younger now. You can't wait till 50. People are already getting breast cancer in their like late 20s, mid 30s. So it's things like that. It's listening to community and actually translating policy based on what is actually happening on the ground. And a lot of people don't have the time to do that. So that's the best way I could describe what health equity looks like. But the last I'll say is representation. Black physicians make up about 2.7% of the physician population. So in a room of 100 people, that's like two people, right?
Wow. Yeah.
So there isn't that representation, yet data shows racial concordance matters.
Yeah.
People need to have clinicians who have like some kind of cultural understanding of them. Even if they don't look like them, at least the cultural bit needs to be there. That makes a huge difference for the outcomes.
Absolutely. Totally agree. Having worked in the medical community, working in hospitals, it is so important. And what we learn has a big impact on those that we serve. those that we represent, those that we support. And it's interesting how, as I went through the process of becoming a clinician, what that looked like, how I was conditioned, what I was told not to say and to say. And yet I still had that innate part of myself where I was a nurturer. I cared about human beings, but the system, as you said, really dictates a lot of things. How long we can be with somebody, what we're going to bill for, how we're going
Yeah.
to treat, the
Mhm.
way we do our assessments,
Yeah.
if we're gathering the right qualitative and quantitative data we see in the office, bedside manner, all of that.
I mean, to give you a simple example of one of the dumb errors we have right now, when my chiropractor wants to do something like get me orthopedic shoes, I need a letter from my family doctor saying that I need this. But they didn't study any of that. So why would they know what the chiropractor needs to do? So it's just weird things like that where you're like, the knowledge isn't even connected. So why must the red tape?
You know what? Okay, we can go down this rabbit hole regarding that discussion because again, my thoughts go directly to why are politicians in the doctor's office? And it's like, okay, well, I don't understand because they're not the ones with that expertise, but they're setting up the system of care, what that's supposed to look like. And to me, that doesn't make any sense. Why did these people go to med school? Why did these people actually become involved in A, B, or C in regards to medical care? Because they care and because they know and have studied and have an expertise. It doesn't mean that they know everything, but it does mean that they are more familiar with what is going on in the human body, what is going on with their patients, rather than somebody dictating to them that they can or cannot do a certain procedure because it is a political issue.
It's the ego jurisdiction things. How many times have you heard someone say, I can't do anything about that because we don't have any permission in that area? And yet it's like, but does that make sense? Sometimes
Yeah.
this
So we
policy created by implementers, I would say, like include implementers.
absolutely. So we need more people like you out there being an advocate, speaking up, talking about the needs of people and how people are also being represented in those rooms.
Mm.
And so, how are we actually making young folks aware that they have opportunities to be there, to be a clinician, to help others in that way, in many ways, in all ways? Just the awareness is really important, which gets me to my next question. You have been recognized with multiple awards for your contributions, including being named one of Canada's top 100 Black women to watch. What drives your passion for leadership, service, and advocacy?
I come from a culture that's pretty authoritarian, right?
Okay.
Shona culture is extremely patriarchal, but also quite like, this person has this position because they're the oldest or, because they're the man or things like that. So for me, growing up, leadership wasn't something that I felt people had given to them because they had a passion for it or they cared about it or understood the weight of the responsibility. And so I've always, always, always wanted to be in spaces where not just being able to grow my own leadership, but being able to grow other leaders, right? So one of my earlier jobs was growing small Black-owned businesses in South Africa because Black unemployment at the time was about like 87%. And I just found that if you impacted one entrepreneur, you impacted at least 9 other people. So you were able to do so much more by helping people who weren't really represented in leadership in many ways. So for me, that's what it's always been like. I love leadership. I love leadership coaches and authors. John Maxwell, I always say, was one of my first like mentors just from reading his books because things
Right.
like the law of the lid are true, right? If you
Yeah.
think of the law of the lid and you look at what's happening politically, then yes, you understand it. Like if someone's awareness level is here and the problems are here, there's just always going to be that disconnect.
Yeah, absolutely. Absolutely. You've been recognized in many different spaces, but as you were coming up, as you were developing, as you wanted to be in those spaces, you were raising awareness about these different things that were important. Did you ever experience any pushback? And if so, how did you overcome that? I want the listeners who, especially our younger listeners who want to be in those spaces, to understand that there is going to be some push and pull. There is going to be some pushback. and to make sure that you keep going. But how is that you kept going? And what would you say to others who find themselves in those spaces that are feeling, oh, let me say, not welcomed or
Mm.
uncomfortable or
Courage.
feeling,
Yep.
yes, absolutely. So tell us more.
I think for me, it is the faith delusion. I'm a woman of faith. And so just believing that, okay, a divine creator gave me this passion and drive because that's what they want me to be covering. That's the community they want me to serve, makes me just assume that I will succeed no matter what. And it's just a matter of when, right? All of these evils that we are concerned about, a lot of people are concerned about them. We may disagree on the ways of solving it, but it's always coming back to the, okay, this is the enemy in the room. It's not us. It's not, it's not us as individuals, right? And so for me, I think evil will always want to creep up, especially in the work of hope. But as long as you're saying there's more good than there is bad, regardless of what newspapers or anything else will say, that kind of keeps you focused. And I will say, I have been in toxic work environments, not to say that there haven't been moments where I've been like, oh my gosh, what am I doing in this place? But I'll also say toxic spaces are a pressure cooker for your growth.
Mm.
Like they're not entirely terrible because when you leave them, you actually begin to understand how it equipped you for the next challenge. And so my capacity has always grown with each toxic space. And so it's like the giants get bigger the further up the mountain you go, but you're so much better off if you know that you survived that first little mini hell, right?
Yeah.
So they're going to be like 7 or 8 little mini hells before you get to the summit, but each one you pass makes you feel that much more like, you know what? I got this. I've got
Yeah.
this because I survived this. I've got this because that person was responding to the threat of what I could be doing. Because that's the other thing. Sometimes pushback is necessary for you to know you're doing the right thing. Like there's no way you're doing it right and not pissing anyone off. So you
Right.
have to, if you're expecting that, by the time the haters are coming, you do the social media thing. Thanks for the engagement. The more
Right.
they're complaining about you, you're like, oh, thank you. You're making our work front and center. You are helping the work.
Absolutely. I love that. What a great explanation, because we are going to encounter that friction. We are going to be in those workspaces that we may consider toxic. But if we can rise, overcome, and learn from that experience, we just continue to rise.
Yeah.
I love the way that you said that. So you emphasize the importance of thinking globally while still acting locally. Can you share the impact of why living life this way and how you support others' well-beings really impacts people locally?
It comes from, being a communitarian people. Africans are communitarian, right? Everything we do has to be about the collective. I think sometimes in capitalist systems, you're taught to kind of be selfish a bit. And it's about like, if I do well, that's all that matters. Or if my family does well, that's all that matters. But we believe in interdependence. And I always say, when people say they don't think they believe in interdependence, I just talk about COVID, that something happened in one place and impacted the whole world and impacted the economy of the whole world. Imagine how different it would have looked if we cared about the thing happening in that one place,
Yeah.
right? And so it's the same with everything, with crime, with all of it. It doesn't impact you until it does. If your next door neighbor is starving and ends up having to get into a life of crime, by the time they hijack your child, whose fault is it now? That's my
Yeah.
question, right? If you cared about this poverty and starvation there in the first place, the crime wouldn't have been a thing. So I think we impact each other a lot more than we realize.
I always see it as that throwing the pebble in the water and you getting those concentric circles and how our influence spreads.
Yeah.
That can spread through what we say, our actions, being a model based on what we say and do, how we influence community, how we bring community together. And this is exactly what you've done in a positive way throughout your life. And you continue to hold on to that hope and you bring that community together. As you said, you've come from a environment where it takes lots of people to come together to make movement, to make a change. So you've brought that forward in all that you do, which is wonderful. We've covered a lot here, but as we come towards the close of the interview, what are you doing now? What are you creating now that you want to share with others where you're impacting society, community?
Because I know that everyone did not have a father like mine, and they didn't have that excellent springboard for the work that they do. I am writing a book called Paid on Purpose, and it helps people to get themselves actualized and actually operate in their purpose at any stage. So even if you are right now just like thinking of doing your first job, there are resources and tools to help people find their purpose and find ways that they can make money through their purpose.
Oh my gosh, I love that. I know that's going to be a bestseller.
From your lips, promoting to God's ears.
Oh yeah, you tag me and we'll share. So as we come to the close of the interview, my last question is, what advice do you have for emerging leaders who want to drive social change but don't know where to start?
I definitely would say that it's like find a mentor. If there's someone you see who's doing something that you would like to do, approach them. Be like, I'm so interested in this. I want to learn ABCD. And some of them actually, they can contact me because I've been doing this most of my life. That's some of what it is. Sometimes I coach around this, but it takes a village. That's what I think it is. A lot of good information is out there, but people won't share it. I'm not one of those people. I want to see us all win. So I think that's what it is. Like find resources, find that community that's doing the work, get mentored, sometimes even get sponsored.
Yes.
I'm more of a sponsor than a mentor. I won't just tell you how to do it. I'll probably give you some kind of door opening as well.
Yeah. Well, I love that. And thank you, Chenai, for being on the Core Women podcast with me today.
Oh, it was epic.
I love this conversation. You can follow Chenai Kadungure on LinkedIn and on Instagram at ChenCad.
Thank you for joining us on the Core Women podcast with Dr. Summer Watson. We're so glad you're here and would love to connect more with you. Find us on Instagram, Facebook, and YouTube at Core Women and on Twitter at Core Women 1. For more about Core Women and Dr. Watson, visit corewomen.com. Want more support and resources for amazing women like you? Great! Join Dr. Watson and Jen Fontanilla at the Life, Love, and Money Collective, a Core Women production that aids in understanding the key traits that might be getting in the way of living a life that you are absolutely passionate about. Connect with Summer and Jen and find out more at thelifeloveandmoney.com.